Good morning, dear students. In the last class, I had discussed about the introduction of pharmacotherapeutics in generally. Today, I plan to discuss about the syllabus which is framed by the Pharmacy Council of India. So it's a 3 hour per week. It's a 75-hour syllabus. Today, I plan to discuss a part of the syllabus copy. In the coming classes, I will be elaborating the syllabus in detail because many of the things are new to you. It's important to understand some terminologies and the meaning of it, so that for understanding syllabus copy, it will be helpful and it can be implemented in the future classes for reference. So let us see the syllabus. Before entering into the topics, let us see the scope of the subject. This is a course is designed to impart knowledge and skill necessary for contribution to quality use of medicine. As we know, the role of clinical pharmacist or any healthcare professional. So in dealing with the disease, we have to use medicine for managing the disease condition or to treat the disease. Quite oftenly, we will be coming across with a word called as side effects or adverse effects. Many times, these side effects or adverse effects may be very much serious, so that it may lead to mortality in a person. So it should be avoided. So it's in the hand of the healthcare professional while dealing with the medicine. That's why the quality use of medicine word is used here. Now, whatever the disease management we are going to deal or we are going to study under pharmacotherapeutics, where we will be using medicine, one or the other medicines will be observed in the prescription, where its quality use should happen. Now, here and there oftenly will be listening with the word quality use of medicine. In future classes, like I won't be discussing this word because generally today I will be dealing what is the meaning of this quality use of medicine. Let us try to understand the meaning of quality use of medicine. Before entering into the quality use of medicine, let us try to understand what is medicine. So many times you might be heard some word called as drug, and somewhere you might be heard about the word which is called as medicine. As a layman knowledge, if you analyze the word drug, so they may think a drug is a substance which is abused. Many times you might be heard the drug which causes addiction in a person. So you might be seeing some health awareness rallies and all which are concerned with the drug abuse day, which is celebrated now in order to generate information to the public about the drug abuse. Let us see the difference between medicine and the drug. In the next slide, I will be elaborating it. Before entering into the drug word, let us see what is this medicine. So this medicine, it may be a prescription based one, or sometimes this medicine may be non-prescription based. So many of the medicine you might be observed in the pharmacies, over the counter you will be getting. It's called as OTC drugs, which is available without the prescription. There are many drugs which cannot be sold over the counter. So for such drugs, prescription is essential. This medicine also includes some complementary types where we will be using herbal medicine, or sometimes like alternative medicines word can also be used over, even that is also considered as medicine, or sometimes Chinese medicine, so on. So there comes under the complementary medicine, as we are not dealing with any complementary medicine, but even though it is essential to know some information about the complementary medicine, because many times the patient without informing, he may be consuming some herbal medicines. So it may cause interaction with the drug. That's why as a clinical pharmacist, we should collect complete medication history. Either it may be of allopathic or it may be any complementary medicines what he is consuming, so that drug interaction can be preventable. Because this drug interaction sometimes it may turn very serious, or sometimes it may counteract the action of the medication which is prescribed for the patient. So in this slide we came to know about different types of medicine, like it may be prescription or non-prescription medicine or sometimes complementary medicine. Let us see what exactly the definition of this medicine. This medicine are the drugs that are used to cure, prevent or treat illness or discomfort. So in future, like whenever the word medicine if you are using, you should be very much clear and particular, like medicines are drugs. Drugs are used to cure, prevent or treat the illness or discomfort in a patient. Now earlier slide I was talking about the word drug. So here we are clubbed with the drug with medicine. So medicines are drugs. But the purpose gives the difference here, because this medicine which are drugs which are used to cure or prevent or treat illness or discomfort. If a person is having some illness or disease or discomfortness, if you are using some drugs for treating such things, so they are considered as medicine. Let us see about the word drugs now. Drugs are substance that causes a change in a person's physical or psychological states. So these drugs are nothing but the chemical substances which are obtained either from herbal natural source, or synthetically it may be get synthesized, or semi-synthetically it may be produced of. But the purpose is different, because medicine, what the drug we are using, so they are used to prevent or treat the illness or discomfort in a person. For the diseased person will be giving some drugs, they are considered as medicine. Whereas here drugs, substances that causes change in a person's physical and psychological state. So here the best example what we can quote, that are the substance abuses. Substance abuse are nothing but the drugs which can cause addiction liability in a person. So drugs, some example we can consider substance abuse like morphine, prolonged use if you are doing with opium derivatives, so it may cause addiction in a person, or lysogenic acid derivatives or nicotine. So these are the agents which can cause addiction liability. So for what purpose they are used for? So they are used for some recreational purposes, in order to get some pleasurable effect. The person will be using it and further he may get addicted. If substances which are used for such purposes, like for psychological states, if it is used, in order to change the psychological state, if it is used, means a recreational purpose, so they are considered as a drug. So now we came to know certain bonds, what is that drug and medicine. In this slide we came to know like medicines are drugs, but they have particular use in order to treat the discomfort, whereas drugs are substances which can be used for getting some recreational or psychological state. So now we can conclude this statement like all medicines are drugs, but all drugs are not medicine, because you know the purpose of using medicine, and generally what is the purpose of using drugs also. So all medicines are drugs, but all drugs are not medicine. Let us move on to the word which is given in the syllabus copy, quality use of medicine. So whenever we are dealing with the pharmacotherapeutics, it is our responsibility to know about quality use of medicine, and whenever intervention if you are doing also, you should be keeping quality use of medicine in the mind. So whenever medicine comes, you should check about the rationale, whether quality use of medicine happened or not, or how to achieve it. Let us see about some key focus of quality use of medicine. This quality use of medicine, sometimes it is called as QUM. So in order to ensure this, some categories you can categorize this like management options, because here management word means the key player in medicine usage are either physician or pharmacist or nurse. They will deal with the medication. So the proper management option should be done. Whenever required, only the drug should be selected of. It's not compulsory, like if a patient is having some minor symptoms, medicine should be prescribed of, because we have two options or two ways to manage a disease. One is called as pharmacological management and other is the non-pharmacological management. Coming with the pharmacological management, we will use certain medicines or drugs for treating the condition, but it should be selected only when normal physiological management is not happening. Non-pharmacological management is other technique which can be employed in the patient. These non-pharmacological methods includes lifestyle modifications. Say for example, diet modification it may be, or inclusion of some exercise, physical activities. Even they have a major role in the management of the disease. So now here management options are selected wisely. Whenever drug required, then only the drug should be given. So then whenever prescribed with the medicine, always you should check about the safety and effectiveness of the medicine. After prescription also you should check about the effectiveness of the drug, and you should check like whether effectively the prescribed drug is utilized by the patient or not, because there may be a chance like person may quit the medication in between once the symptoms got masked. That's why like safetyness also should be checked and also effectiveness. So now here 3 points we can observe that one is the management option, that's the decision what you are going to take, like whether I should go with the pharmacological or non-pharmacological management. Second means suitable medicine should be selected or chosen whenever if you consider it is necessary. So then medicine if you are used means safety and effectively should be used of, so that whatever the patient or the consumer what you will be calling him, so he will be getting the best possible outcomes.